Good afternoon, everyone. I am Kat Anderson, the director of the Roundtable on the Promotion of Health Equity under the Board on Population Health and Public Health Practice at the National Academies of Sciences, Engineering, and Medicine. I want to introduce today's moderators, Ms. Lauren Russell and Dr. Melissa Simon. Lauren comes to us today from the U.S. Department of Veterans Affairs, and Dr. Simon is a member of the Roundtable on the Promotion of Health Equity and a faculty member in the medical school at Northwestern University. Dr. Simon, I will turn this over to you.
Thank you, Kat. Welcome, everyone. I want to welcome you all today to the webinar on COVID-19 disaster preparedness and vulnerable populations. This is the second workshop in a series of 3. The first workshop was held June 17th, and the third and final one will be held July 15th in a couple of weeks. I hope you will all return and attend the third workshop as well. Today's workshop will be a series of discussion questions for our panelists, and we will plan to have time at the end of the session for audience questions as well. As the COVID-19 pandemic has progressed, essential healthcare workers, such as physicians and nurses, have deservedly been highlighted repeatedly, which is, of course, completely appropriate. But one group of essential healthcare workers has largely fallen through the cracks: home health aides, personal aides, and family caregivers. These are essential workers who are underpaid and undersupported. This workshop is going to shine a light on these largely invisible essential healthcare workers. According to the CDC, 70% of caregivers, both paid and unpaid, were found to have significantly worse mental health symptoms when compared to non-caregiving adults during the pandemic. The most commonly reported were symptoms of depression and anxiety. The CDC noted that there is a desperate need for mental health disaster support services for caregivers, and home health care workers and other caregivers are primarily women. And of those who are unpaid caregivers, 71% also had other paid outside employment. Personal aides are overwhelmingly female and either white or Black. The average salary is just under $22,000 per year, and home health aides also make a salary of about $22,000 per year and are primarily Black in the United States. 2020 data from the Migration Policy Institute indicate that 38% of the home healthcare workforce are immigrants. A large percentage of immigrant direct care workers emigrate from Caribbean, Central America, Southeast Asia, with Mexico, the Philippines, and Jamaica representing the top 3 countries of origin. Given a workforce that is largely Black and immigrant, the Roundtable on the Promotion of Health Equity is interested in learning more. I now want to turn to my co-moderator, Ms. Lauren Russell. Thank you.
Thanks, Melissa, and thank you to everyone else for joining us today. I'm now going to introduce our 3 panelists. So first up, Robin Cleveland is an advocate, caregiver, life coach, and mentor who provides support to a range of caregivers, veterans, and civilians experiencing life-altering events through her work with the VA Caregiver Peer Support Mentoring Program, Christopher and Dana Reeve Peer Mentoring Program, and Red Cross Military and Veteran Caregiver Network, among others. Robert Espinoza is the Vice President of Policy at PHI, where he oversees its National Advocacy Research and Public Education Division on the direct care workforce. And Zulma Torres has worked as a home health aide at the Cooperative Home Care Associates Agency for 23 years. In this role, she provides care for her clients on a daily basis and assists with their activities of daily living. There's also much more to say about these 3 panelists, so we posted their longer bios on the website and certainly encourage you to check those out. So one other logistics item here before we begin with our questions is that we really encourage audience members to please ask our panelists questions and to do this through the Q&A box at the bottom of your screen. So our plan is to have time for these questions at the end of the webinar. Alrighty, so with that, we will begin with the first set of questions here that are focused on training and training needs. So the first question is for Ms. Cleveland and Ms. Torres. What types of training opportunities were or are available to caregivers dealing with COVID-19?
Good afternoon. Prior to the pandemic, the VA has instituted a series of training opportunities to caregivers. The pandemic gave them the opportunity to expand the availability and the frequency of those trainings for people dealing with COVID. They included things like virtual conferences, caregiver education calls, calls that included it's a program called REACH, which is Resources for Enhancing All Caregivers' Health. There's Building Better Caregivers, a caregiver support line, it's peer mentoring, and then there's also tech support. The range of topics included a variety of courses that included like managing your anxiety, how to manage stress, the importance of self-care, managing challenging behaviors, compassion fatigue, and so many others.
Thank you. Ms. Torres, do you have anything you'd like to add?
Well, yes, I agree with Robin. Basically, that's what they provided for us. A lot of texts and webinars for anxiety, for depression, and how we were feeling, to feel better. And if we had any questions, to ask them, that they would support us. But myself, I just handled it in a different manner, because even though all those things were good, we were worried about what's happening. And what I did was that I educated myself through the same websites that they will give us. I will read into more things and share it with my coworkers, and we follow that. With that being said, we supported one another, and yes, they gave us webinars and texts, and they showed their concern. But basically, as a person on the field, you worry, and you want to make sure everything goes accordingly, and that we're protected and we're safe. And to the day of today, we continue doing these things.
Thank you. That was really helpful to hear from both of you all. So the next question here is for Dr. Espinoso. So we're really curious to learn more about your organization's response to this. So did you feel like you all were caught off guard by the pandemic disaster, or had you, put in place materials or plans in preparation for maybe not something quite of this scale, but something, sort of more proactive? And what types of training were you able to provide to your members? And I realize I asked a couple questions there, so if you need me to repeat anything, just let me know.
No problem. Thank you, Lauren. And thank you, Zolma and Robin, for your comments as well. I mean, I think like many organizations and people around the country and around the world, we were surprised by the pandemic. I think we were watching it from afar as it was taking hold in other countries. And it really, what we saw in the US is that it dramatically took over nursing homes first, right? We saw this in Washington State. We saw this in other parts of the country. And overnight, PHI, we realized that our perspective was really important in making sure that direct care workers in particular had the information, the supports, and the government attention that was going to be focusing on this sector in the months and years ahead, depending on how. PHI is, we're a national organization that's focused on strengthening the direct care workforce. And we do this in 3 ways. We do research, we do policy analysis, we advocate for reforms at the federal, state, and local level, and we design workforce interventions. And I would say the first things that we did, one is we monitored the situation and we issued articles and policy analysis on what was happening, what direct care workers needed. We developed, a section of our site that had regular updates on issues and challenges that were facing these workers, and specifically what states could do as well, because we were seeing that the pandemic was emerging in certain parts of the country and states needed guidance, right? And they needed the information that they had. And that section on our site, by the way, is still available. We also worked very closely with reporters who, like the rest of us, were trying to figure out what was happening. And so we helped, as we usually do, we help reporters understand who are these workers, how do their needs and challenges differ across settings, in private homes, in nursing homes, and in residential care settings. What are the key challenges? Sorry, and how can the story be better told to ensure that these workers stay front and center and that the policy response stays front and center? But I would say that it was heartening to see that in many discussions that we were a part of, people were aware of how valuable specifically home care workers were, but also nursing assistants and residential care aides. I think there's still a lot that needs to be done, but I think we've seen some good progress for sure.
Thank you, Dr. Espinoza. Just a quick question to follow up on that. Can you tell me how hard it was? What was that process of getting the information in real time that you needed to be able to put that on your website so that you could tee up everybody to have the most up-to-date, accurate information?
Yeah, it's a great question. So PHI, we have a really strong research and analysis team of writers and thinkers, and we follow the news pretty closely. And I think, we had regular meetings, several meetings during the week, and we were always, of course, on email conversations. And we simply knew that this was a historic moment. It was an unprecedented moment. And we needed to basically be all hands on deck, right? And so, immediately we decided, what are the key topics that we need to dive into? Who are the people and the experts we know in the field? How can we develop kind of a real-time library of articles and analysis on different aspects of this workforce? And we were producing, articles every few days. We also issued a survey of our network of organizations, of experts and journalists who really follow us for direct care workforce knowledge. And that survey gave us a better sense of what do employers need, what do workers need, and how can we respond to that. So I would say, our work hours were 7 a.m. to 7 p.m. We were working oftentimes on weekends, and every day was a new learning, but we knew that this was what our training and our mission had set us up for, that when a catastrophe strikes, we need to use every tool at our advantage and just produce as much and learn along the way. I think we learned quite a bit. So it was an all hands on deck, I would say 7 days a week strategy for a few months.
Thank you. Appreciate that. The next set of questions focuses on whether your caregiving responsibilities changed due to the pandemic. So this question first is from Ms. Cleveland. Did you experience changes in your caregiving responsibilities due to the pandemic? And if so, did these changes impact your family life and family dynamics?
I'm unmuted here. Well, I've been a caregiver now for 18 years for my wounded warrior. The pandemic, fortunately, did not have an impact on my family life or the dynamics because I provide care 24/7. So it was simply, business as usual. And in my situation, the key ingredient is consistency. Maintaining the schedule in order to be able to balance my caregiving responsibilities and my family responsibilities. If anything, what the pandemic did do was force me to become more creative in creating space for in-house respite for the entire family.
Thank you very much. Now for Ms. Torres, how did you juggle your caregiving responsibilities with your own family responsibilities?
Well, for me, it was a little different because I live in Connecticut and I work in New York City. So my family and I, we became a team. My daughter lives in Mount Vernon and they will pick me up on the day before my shift and I'll just stay in New York and do my shift, take care of my client, and then they'll take me back home. We came to terms to do that because I travel in the Metro North. And as we all know, the Metro North passes through New Rochelle. That's the same train I take. And that was the first train that was infected with the COVID. And we were really worried because it's 3-hour traveling for me. So we came up with that plan. I'll stay with my daughter because she was working from home. My son-in-law works nights and he'll pick me up in the morning because I also work nights. So we kept close, and at the same time, we social distance from everyone else because we don't know what's happening, but it actually worked out. And to the day of today, that's my routine. So it was pretty good. My husband understood, my son understood, and my oldest daughter was hands-on, and we protected one another. Scary moment, but I feel that as a team, anything is possible. And that's exactly what we're doing now. And as everyone else is doing, you know, we're working together, we're learning, we're experiencing, and we're more cautious with things and we're more on hands. I don't let it depress me. It just scared me. I feel that I'm a type of person that when I'm scared or I'm nervous of something, that's when I want to work harder. And during this pandemic, it made me want to work harder, learn more, educate myself, and also my family. So I bring that also to work the same way I take it home. So it kind of worked out okay for me.
Thank you very much. Now for Dr. Espinosa, what resources are available for caregivers who are having to manage pandemic challenges and issues with their own families?
Yeah, I mean, I think that generally the resources, you know, if they're available, are through employers. So if employers have, you know, a specific, you know, set of educational resources or tools that they use to really ensure that their workforces have proper information, I would definitely start there. Certainly there are organizations that focus on both family caregivers and direct care workers. And for many people, their family caregivers are direct care workers and vice versa, right? But, you know, groups like AARP, which has an explicit focus on family caregiving, I think offers great information. So does the National Alliance for Caregiving, and their websites have dedicated resources on for family caregivers in particular. For direct care workers, there are some resources through PHI, although most of our resources are geared more at employers and at policymakers. There's also the National Domestic Worker Alliance, which I think has great information. And increasingly, I've noticed that online publications have been producing kind of good resources for both family caregivers and care workers. So I think there's probably a way of finding that information online as well.
Got it. Thank you. Now back to Lauren.
Alrighty, so our next set of questions focuses on mental health and the pandemic. So Ms. Torres, the first one is for you here. And I think you actually already spoke to some of this in your previous question here. But, you know, maybe if you could discuss further, or if there are, you know, alternate perspectives you'd like to share. But we're really curious about, you know, the emotional toll that you might have experienced from working during the pandemic, which I know you talked about the impact of that just in terms of being scared and, you know, having to rearrange sort of your family life. But I just wanted to give you the opportunity, if there are other perspectives you have, or just in terms of your work environment and the emotional toll of doing, you know, this job.
Right, it's difficult at times. It takes a toll. But I want to say I do my job at 100, and it's hard. It's hard because it's like I said before, I live in Connecticut and I work in New York. I've been out there for years now. And it takes a toll, but with time and understanding, I come to peace. I find peace within knowing that what I'm doing is the right thing. I know my clients need me. I know my family needs me. So with that, I know how to separate my family from my work, and I take it personally. And I guess, you know, I get up, I'm a believer of God. I leave it to God, and I go there and I do my duty to see someone smile. And that helps my mental, that helps my anxiety, because I know that what I'm doing, even though it's difficult and we're in a difficult time, but to know that you could put a smile on someone's face, and it's a blessing. And to know that my family is there to support me, and they understand clearly the decision that I made when I first moved to Connecticut. And then this happening, like I said, we came as a team to work with one another so we can make it easier. And I also have shared that with my coworkers. You know, we went through a lot because one of my coworkers, her mom had passed due to COVID, and it was stressful. We don't know what's happening. We're afraid. But like Robin has said earlier, through these webinars and the company keeping us on point with what's happening and what should we do and how could we prevent certain things, it all came together, and it does work out. And it's easier for me to say a day like today. But in the beginning, it was really nerve-wracking. Mentally, I didn't know which way to go because that happens. But a day like today, we're head on. I'm doing what I'm supposed to do, and I'll continue learning, and I'll share it with my family as well as with my coworkers, and I take it to work as well. You know, with my clients, I treat them professionally, but with respect. But once again, my goal is to see that smile, because a lot of our patients, they don't have family members. Exactly what you just asked me, you know, how was it challenging for my family and for my work? It was because I couldn't stop working, even though my kids wanted me to stop. One of my sons wanted me to stop, but I kept telling him, I'll take my time, don't worry. Hello?
I think you're okay to continue, Ms. Torres.
Yeah,
Okay.
I'm sorry, I don't know what that was, but please continue talking, Ms. Torres.
Okay. Okay, so I even lost my thoughts, but we're getting back. Yes, you know, a day like today, it's I kind of lost myself for a minute. I am so sorry, but
It's okay. You were talking about how your family didn't want you
right.
to work, and
They didn't
you
want.
said you
Thank
had
you.
to keep
Yes.
going, my dear.
Yes, yes, thank you. Yeah, my son didn't want me to work, so every week I'll tell him, no, next week, don't worry, I'm fine. I'm not gonna go to work. And they will wait for me to come into the house, and I will take off my uniform. He'll put it in the shower. There was a towel waiting for me. I'll take it, you know, I'll go in the shower. I couldn't say hi to my granddaughter that resides with us because I was just coming in. We didn't know what's out there, if I was bringing anything home. So we went through a whole big process. And the same process that I did in my home, I also did at work. I have great co-workers, and we protected one another, and we still do to the day of today. So like I said in the beginning, it was really hard, scary, not knowing what's happening. But a day like today, we have more control. And even though a lot of things are opening, but I still keep that distance, and I'm still not in crowds. But the problem that I'm having now is that I'm back in the Metro North. So I still got to protect myself because things are opening up. It's hard for my son-in-law to pick me up, a lot of traffic. So once in a while, they're able to do it. But in the beginning of this, I'm very blessed because they were able to help me and assist me to get back and forth and to accommodate me because they were concerned. So we protected each other. We protected each and every one of us all the way around, as well as I protected my clients. And where I work at, we have 2 clients, and we have a set of 7 aides. And we all got together on a group chat, and we made sure that we protected one another. And like I said before, we did have a loss, a good coworker of mine. It was very hurtful. And to the day of today, it's sad. But continuing, we hope and pray that things will get better and that this virus could go away, or something could work for this. Because I'm still worried. Yes, they have a vaccine. I read a lot, so I read on each and every one of them. I'm hoping that would help and we could stop this. I don't know how or when, but I guess as we're doing social distance, keeping away and putting our masks, I'll continue doing all of that until there's a solution to this, because it broke many people's heart, all of us. And it's something so scary, and we don't know. You know, I could just go on and on saying how would I feel about things, but I'm just happy that in my case, everything is going well. We still have our Lysol, our sprays. I still work with all of that as well. I'm a walking bag. And basically, things seemed okay. And as a home health aide, I am very happy that I do this job because I know that I could help someone. It's a time, but I'm able to do it. My concern is that where do we stand as home health aides, as caregivers? Like I said, I could go on and we could get into different conversations, but I just want us to be acknowledged, to know that we are essential, that we go and we take care of our clients with love. A lot of these clients don't have family members. So asking me about my family, they're there. But to know that a client doesn't have a family member, that doesn't have no one, and they only depend on us. And even though we have to keep it professionally, which I do, and I've been doing it almost 24 years now. In August, I'll make 24. I'll do it professionally, and I separate one thing from another. But just to see them smile, to feel comfort that they okay, I'm happy, because they'd rather be in a home base than in a nursing home or in a hospital. That's more sad for them. In their home, they're comfortable. They know that we're there. We protect them. We wear our mask. They wear their mask. So we came as a team, and I'm happy that is workable, and we're going forward. That's what I can share with you.
Thank you. We really appreciate that, and also all of the work you've done. So thank you for both sharing your experience and also for all the work you've done throughout the pandemic and also continue to do.
Thank you.
So the next question, we'll give you a quick break. So Ms. Cleveland, the next question is for you, which is really, we're curious because this topic has come up a lot during the pandemic in terms of increased feelings of loneliness or social isolation. And so, we were hoping that maybe you could talk more to your experience about that and, how that impacted you.
Absolutely. Personally, for me on this journey, I've been extremely fortunate. I have a great set of children. We all have been quarantining together. Even prior to COVID, they were part of their dad's care team. So they fill in for me. So they're used to caring for him. And when this hit, we just all, they moved in together. We are in one house under one roof. So with that, a house full, it made it a little easier, not being able to connect as often as I normally would have with other caregivers or just, people in general. So there were definitely occasions where I probably felt like there wasn't enough space for me. But I'm, again, very fortunate in the fact that it didn't linger very long. I've been able to cultivate, in addition to, the family support, to cultivate some amazingly incredible relationships. So even if something like that, if it did linger a little longer, I was able to reach out to someone to, have a conversation or, just touch base and check in on, we did this on one another just to see where we were, a lot of caregivers don't have that. And I understand that. So I am very grateful for what the VA has provided. In addition, like the other agencies that I work with, that caregiving on all levels is extremely stressful, to be honest. Whether it's a couple of hours a day or it's 24 hours a day, it's a lot. And it sometimes leaves you feeling at the end of the day alone or just craving some outside interaction. My wish is that a lot of the other care providers had some of the same access to the resources and the networks that the VA and some of the other agencies have created to help us navigate this space.
Well, I'm very glad to hear that you felt like you got resources. And I think maybe at some of our Q&A at the end, we'll probably revolve around, how we can maybe increase those resources or access for others. But I'm very grateful to hear, at least being from the VA and representing the VA, I am very grateful to hear that you at least felt like you got strong resources from the organization.
Oh, absolutely.
And thank you also for all the work you've done.
Well, thank you guys for making it possible.
So the very last question here, just for this section, and then I'll pass it back over to Melissa, is Dr. Espinoza. As we spoke about at the beginning, we were talking about CDC data on mental health symptoms for individuals working as home health aides or caregivers. And, did you sort of see this broadly among your membership, and were there resources available to support these workers and volunteers? So once again, sort of focusing here on, mental health and the pandemic and how your organization handled that.
Yeah, so it's a really important topic, and I really appreciate Thomas and Robin's comments. I think what we saw during the pandemic and seen kind of historically across the sector is that, mental health issues are an important topic for this workforce for a variety of reasons, right? Certainly a number of workers will experience the loss of clients, or sometimes often the loss of family members as well. And during COVID-19, especially the first few months, this was a common story. Imagine in, nursing assistants in nursing homes where the pandemic was having such a dramatic impact, but certainly in home care settings as well. And many home care workers weren't able to access their clients. So there's an emotional anxiety to not be able to see the people that you've been supporting. Also, there's just a general increase in anxiety and stress during the COVID-19 pandemic. And we saw this through other research that all of us we were seeing an increase in anxiety and depression rates, for example, right? And yet what we know is that mental health support in general is expensive, and it requires, the ability to see a therapist and see, dedicate time in your schedule. And what we know about kind of the wages and the compensation rates among direct care workers is that the median wage is around $12 an hour, and many don't even receive the kind of benefits that would allow them to receive this mental health support. Also during COVID-19, we saw that most treatment went virtual, and many of the virtual therapists that were available had long wait lists, right? So it was pretty hard for anybody to access a therapist. And many employers don't always have mental health supports, and that includes specifically grief support, some kind of mechanism when a worker is going through a tough situation that they're able to kind of address it. But the other is bereavement leave. When someone passes away, is there paid time off for a worker to be able to make sense of that? I would say two things here for a research audience and also for a broader audience. From the research audience, I think what's needed is really deeper understanding of the mental health kind of experiences and implications for workers. What does that look like specifically across the variety of mental health challenges? How does it impact them on the job, and how did COVID-19 kind of complicate or address that? But also, how does it affect turnover? Because it ultimately services and supports that they deliver, and how are their employers providing or not providing support in this regard? And what do workers want, right? If we were to survey workers and family caregivers, what is it specifically they want that policymakers or employers could fit in? On the social isolation thing, I'll say really quickly, it was interesting that the month before the COVID-19 pandemic took hold in the US, the National Academies of Sciences, Engineering, and Medicine released a report on social isolation and loneliness among older adults. And I was fortunate enough to serve on the committee that advised the report. And yet what's so critical, and this report points out as well, is that home care workers are a big part of the equation for how to support older adults in particular, but also people with disabilities across the lifespan on addressing social isolation and loneliness. Home care workers in particular might be the only point of contact for many people at home, and they're ideal for spotting symptoms of loneliness and for helping build community for the consumer, the older adult, and the person with disabilities. And yet what the report argued, and we need this, is that we need to grow the evidence base on interventions in direct care. We need to better educate the public about isolation and loneliness, and ideally that would support the workforce as well. And we need to strengthen workforce training specifically on isolation and loneliness. I would say on broader mental health issues, but it was a really important report that speaks to many of the issues that are being discussed right now.
Thank you very much. I appreciate it. And yes, that's certainly a topic we've discussed in the VA, a lot of increased screening for loneliness and social isolation, but then what do you do if someone expresses that need? What is the appropriate follow-up? And I'm sure it looks different for many people, whether it's clinical follow-up or trying to connect them with, maybe community groups, or for veterans, a lot of times there are coffee socials and things like that where we can connect them with community members outside of clinical care settings. So thank you for speaking to that. And I will pass it back to Melissa for the next set of questions.
Thank you. Thank you all for this panel discussion. Your responses have been stellar. Thank you. This set of questions is about policy. What policies would be helpful to have in place for future pandemics or other disasters? Ms. Torres, are there things that you wish you could have changed in your experience as a caregiver during the pandemic? What would have made your job easier to manage?
Transportation. I say transportation. Because for an example, if before the pandemic, I was taking 3 buses to work, right in New York. I would take 3 buses to work. I'll take the 9, the 19, and the 5. So during the pandemic, everybody was afraid. And if they had resources, or they would have set up maybe a bus or essential buses to take us back and forth, that would have helped a lot. I think after the, with what's going on right now, if they was to set something up, if something in the near future comes, we'll be more prepared.
Makes a lot of sense. Wow, I can only imagine. How many buses so you had to have your family drive you when the pandemic
Right.
started? Did that change as the pandemic rolled out or
But
proceeded?
it has. Now it's been like 3 weeks now that I'm back on my own because everything has opened up and there's so much traffic now. I said everybody bought cars over the pandemic, well, still in the pandemic when all of this happened because everybody's afraid. So now I'm back on the train and it's 3 hours from where I live in Connecticut to come to New York. Even though I understand I made that decision before I moved, but now with this happening, it was very scary and it's a lot of traveling. And now the buses are so crowded. Everything is just, we're like sardines in the buses again. Everything, so we still got to protect ourselves, but everything is like a little chaos.
Okay. Ms. Cleveland, are there rules and regulations from the Veterans Administration program that impeded your efforts to provide caregiving? You're on mute. Yeah, I think you're saying no, but
No, there aren't. From my perspective, the veterans and caregivers did not experience a break in services or care. I think that the VA even took it a step further by expanding some services to include the virtual options during the pandemic. In addition to including the virtual, the caregiver support program also expanded its reach and resources to include, the peer support mentoring, again, the caregiver education, reach, building better caregivers, the support call line. I think that the VA has done and continues to do an exceptional job of trying to make care inclusive as they care for the people who care for the veterans.
appreciate that. Thank you. Dr. Espinosa, what are your policy recommendations for the future for home health aides and caregivers in a disaster such as this pandemic?
Yeah, I would certainly reinforce Zolma's points around transportation. I do think that it's a big part of how workers, succeed on the role and on the job. And certainly we need to figure out, how do we compensate workers for travel time? Are public transport systems being built, updated, and our employers offering financial support for transportation as well? I would say the policy recommendations for me would fit into 2 buckets. For PHI would fit into 2 buckets. One is related to COVID-19. I think we need a lessons learned analysis that's commissioned at the federal level, but certainly at the state level as well, and in different states, about what did we learn about the direct care workforce, the home care workforce in particular, because of the COVID-19 pandemic, and what are the gaps, what are the strengths, what needs to be built. At the forefront, I would imagine there would be policy recommendations related to emergency preparedness and infection control and prevention. And yet we know that challenges that these workers faced were long-standing. It was just that COVID-19 reinforced them and amplified them. And in that sense, I would focus on policy supports that address the quality of direct care jobs and home care jobs in particular, and family caregiver supports as well, right? We need more compensation for workers. We need to ensure that they have a living wage, they have access to benefits and full-time hours. We need stronger training systems, a stronger training infrastructure at the state level, but in some cases, stronger training requirements, especially for personal care aides that don't do the clinical work that home health aides do. We need career advancement opportunities so that workers can advance in these careers and we can improve care, but also workers can have an opportunity to elevate their titles and their compensation. And we need better data collection systems and in general, a broader recognition and support. I would say a policy succeeds, though there are probably many ways to measure that. But one way is that I feel like it would address this long-standing challenge with the direct care and the home care workforce, which is that too often it's seen as low-skilled labor, when in fact it requires quite a bit of skill and training, and it requires emotional support and problem solving on the job. And so if policy succeeds, we should be valuing direct care workers and family caregivers for the incredible and complex level of support that they're offering.
Thank you. Thank you very much. I'm passing it back to Lauren.
Alrighty, so these are the last couple of structured questions we have, and then hopefully we will have a little bit of time for the audience Q&A. We've gotten several questions. So first up here, and this is broadly for any of you all, is how can we better prepare home health aides and caregivers before the next, pandemic or disaster occurs?
More programming.
What'd you say? I'm sorry.
More programs.
More programming. Got it. Any particular types of programs that you think would be, particularly helpful that you would like to highlight?
Well, if you hear me?
Yes.
Yes.
We can hear
more
you.
Programming, like I said, more and more validation to us, in the sense, more caring, so we could go out there and be more prepared and do our job. We're not recognized, and we do a lot. So if God forbid this happens again, they should more meetings, more programmings, more communication, and to prepare us to go forward, because this was unexpected for everyone. And thank God that we have the universal precaution and we know how to protect ourselves from whatever, how can I put it? From whatever problem a client has. So I'm gonna say problem, because I don't wanna, they're diagnosed. I don't wanna use that. I always say problem. But that we could protect ourselves. But be more, how can I put, as a home health aide, look, this is my situation. As a home health aide, I speak for every home health aide. If they was to show us more concern, give us more programming, give us more attention, let us know that we are someone, that we're not just someone that you send us to a home and you leave the home. You recognize us and you give us that respect. Then I think it's a lot easier. We'll be with a smile, because this is what happens. A lot of aides stopped working when this happened. Why? Because they were afraid. Exactly, going back to what you had asked me. What would we need? More programming, show more care. Show us that we're someone, that you validate our job. We work as a team, and we don't have that. So if there was to do that, it would be great for each and every one of us. And if something was to happen in the near future, from this time to what happens next, we'll be more prepared. But help us out too. We need the help as well, because we only know what we learn and what they teach us and what we follow. So that's my concern with this field, that I want it to be recognized, give them program, have mentors to help them out, more mentors, more PPE for us, protect us better. A lot of girls stopped working during the pandemic because they were afraid. But why? Because why am I gonna go out and work and I'm afraid when they don't even acknowledge us and we don't even get paid well? And those things is a factor. We're human beings. I found the love for it. That's why I kept going. And I didn't let not even my family stop me, and they understood. So if they could at least hear that and understand that we have to multitask mentally and physically when we're in our client's home, and then I think that this type of field will be recognized and we're gonna go forward.
Thank you for sharing that. Yeah, there are definitely some follow-up questions that I'll wait till we wrap up the formal question part here, but about what currently exists for compensation and providing PPE and things like that. But I'll hold off just a little bit longer to see if Ms. Cleveland would like to add anything, or Mr. Espinoza. Are you speaking, Ms. Cleveland?
Yes, can you repeat the question, please?
Yes. So the question was, how can we better prepare home health aides and caregivers prior to the next pandemic or disaster?
Well, I think the VA, and I probably have said this a lot today, has done an exceptional job. I think the biggest challenge, should this occur again, it really isn't so much with with the resources that are currently available. It's more about how it's about connecting with the potential caregiver. There's a lot of hesitancy, reservation on the new caregiver's part. Probably better phrase, trust. I think if there's a little more work put into bridging that gap with the caregiver so that they feel a part of the process, the current resources that are available, continue to grow them and expand them, I think the program will, or the availability and access to the current resources will just continue to grow and just improve. But it has to start with kind of the new caregiver, or even some of the older caregivers, just making them more comfortable with accessing them. And that just kind of, I think, comes with the connection, that human touch piece. Because you can put everything on the internet now. I mean, you can virtually do almost anything, but I think sometimes for some people, they need that personal touch, that conversation, that direct validation, that I don't know, that warm and fuzzy to say, you know what, I'm in this journey with you. I can help you kind of identify, you know, to be able to kind of self-assess, if you will, kind of like where your stress markers are. Like, so you know yourself, you know, I may need to take a time out here, or just little things on how to, you know, identify periods of self-care, like what that kind of looks like. And, you know, sometimes people need to know that it's okay to say no, like to set boundaries. And I think sometimes caregivers get into a place where everything has to be a yes, and they forget that you're not able to care for the next person if you don't care for yourself first. And I think that with everything that's available, starting with that caregiver, just that human touch first, everything else will fall into place, because I think the VA has done an exceptionally phenomenal job at creating programs and avenues and you know, just opportunities to make things available to help improve your life and to ease some of the burden or the stresses of caregiving. The financial piece, I mean, from a family caregiver standpoint, it kind of is what it is. You lose a lot. I personally would take this over the alternative any day. Not everybody can say that. They need, you know, to work outside. I will do things outside as well, but 24/7 is a long time. It's a long time, and 4 walls will drive anyone crazy after a while. And I think just kind of teaching people how to manage those dynamics and how to navigate that space in addition to the resources is kind of what's needed.
Thank you.
And hopefully I answered that question.
Yeah, no, you did a great job. That was all very helpful. Mr. Espinoza, I'm going to let you go if you have an answer, and then I'm going to quickly switch to try and get in 1 or 2 audience questions, just looking at the time.
No problem. And I think what I would say quickly is that, you know, building on Zolma's and Robin's comments, Certainly, if another crisis similar to COVID-19 emerged, we would need to make sure that workers have regular and improved access to PPE, to supplies, to testing, as well as a whole range of safety protocols and kind of particular attention for workers. We need to make sure that they would have access to hazard pay, emergency leave, affordable childcare, a wide range of job supports like mental health supports, which is what we discussed earlier. And we need to make sure that the entire long-term care system, including their employers, have adequate relief funding, which I think we might be able to argue, we could argue that it wasn't the case during the early stages of the COVID-19 crisis. But I think we would say that high quality jobs are probably the best defense for any future crisis. And so if we really want to make sure that workers can navigate a crisis and family caregivers can navigate a crisis safely and effectively, we need to make sure that they're properly compensated, properly trained, properly supported in the long term, not just during a crisis, because I think a worker should be able to enter a crisis knowing that they already have that backing. I'll leave it at that.
Thank you. So I realize we don't have time to get through all the questions, and we've gotten quite a few, upwards of 18 at this point. So I'm going to attempt to ask one and hope that it's maybe answers a couple, which is really, you know, what types of programs are currently in place that help and support caregivers? So maybe those outside of just the VA, because Ms. Cleveland, I think you've done a great job talking about all the resources that exist within the VA. But what other programs are there, maybe either local or through the state? And Ms. Torres, maybe you're well positioned to answer this. But I think the question is, you know, what exists to support you all? And also, were those organizations able to help you get access to PPE or vaccines, you know, as those became available? I know you mentioned PPE in particular being challenging to access.
Well, our union, they on point. I say they on point because they do send us, can you hear me?
Yes.
Okay, no, I lost you. Yes, well, our union sends us always links, and so we could know what's happening and how to be aware. And I think as time has went by, even the company itself, you know, they're on point. They know, because in the beginning nobody knew, and now they know how important it is. And it's been I think it's more organized now, so it's great. And I think that from this point on, I think it'll just get a little better, because now we all aware what to do, what we need and what we don't need. But I think that the company, which I work for, Cooperative Home Care Associates, and our union has teamed up perfectly now, I guess, because, you know, things have progressed and they know how important it is to protect one another. So it's going forward. And exactly what Robert said, he couldn't say it any clearer. He said everything that I agree with him, because it's true. At least, you know, we care, they care, and hopefully these things will be in place so our job could be easier. And going forward, sometimes we need that human connection and let us know you guys are okay. But I think that with the links and their communication they're doing now, it's working pretty well for us.
Thank you. Melissa, any questions you want to ask? I know we have many to choose from.
I think we've definitely covered a lot of the topics that come up in the questions, you know, around how could we better support you? How can legislation better support you? How do we increase your pay that you so much deserve?
Yes.
But before I let you respond to some of that, I really want to say there has been a resounding theme across many of our people who've posted in the questions, and that is just hats off to you both. You are amazing. I mean, and Dr. Espinosa as well, but to be on the front lines and to be caregivers, I mean, amazing what bravery that you all have shown, and deep heartfelt thank yous from many of the people in the audience and from us as well. So, you know, what could help a little more? You know, maybe Dr. Espinosa, is there some more direct things that could be done right now to help support caregivers more with respect to legislation, policies for pay, that seems to be, and benefits seems to be resounding importance.
Yeah, absolutely. I mean, I think, we've seen a few bills and a few plans introduced in the last few months that, if they were enacted, would do quite a bit for strengthening the direct care workforce. One of them is, of course, the American Jobs Plan and American Families Plan that is part of the infrastructure package that President Biden has introduced. If those measures were enacted, it would boost about $400 billion into expanding home and community-based services and improving wages for home care workers. There are also a number of other measures in the American Jobs Plan that could be used to strengthen training and advancement and recruitment and retention supports for these workers. So that's one primary point. The American Families Plan also would expand paid family and medical leave, I think, for many workers, including direct care workers, and that would be a great benefit. And we've seen bills introduced also, like the Direct Care Opportunity Act, that would fund workforce interventions related to training, advancement, and others in direct care work, and a few others that address data collection and direct support professionals, which are the part of the workforce that supports people with intellectual and developmental disabilities. I think the point that I would make here, though, is that, we've seen a number of bills in the past, and unfortunately, they don't make it past introduction. So now is really the time to capitalize on the interest that the COVID-19 crisis has created to finally pass these laws, right? And in 2 weeks, PHI is releasing a federal priorities report where we're going to spell out not just the bills that can pass, but also the wide range in which departments and agencies across the federal government might support these workers across compensation, training, advancement, data collection, equity issues, and so much more. So it is a good time for us to be thinking about this question.
That's what I wanted to hear. Thank you so much. And thank you for your organization and for all the work that you do. Obviously, Ms. Cleveland and Ms. Torres, thank you. I need to pass it back to Kat now because we are running out of time.
Okay. Oops. Okay. Hi, everyone. Thanks again to our panelists and for everybody who attended today. I am going to put up one final slide that, if I can, that will show you the website where you can pick up, you can watch this webinar again, and I'm having trouble making it go forward. Let's see. Okay. All right, everyone. Thanks so much. And the next webinar in this series will be in 2 weeks on July 15th, again at 1 p.m. Eastern Time. Thanks.
Thank you.
Thank you all.
Thank you.
Thank you.
Everyone,
Thank
great
you.
job.
Thank you.
Ciao. Bye.